When choosing a Medicare plan, you must consider the impact of inflation and the inevitable increases in medical costs over your lifetime. You may have your Medicare for 20 or 30 years or even longer. Understanding how your Medicare plan is impacted by inflation is crucial to your long-term planning. In this video, I will review the different parts of Medicare and how they are impacted by inflation. And this includes original Medicare, Medicare Advantage plans, and Medicare supplements. I will also discuss what you can do today to hedge against the rising costs or declining benefits in order to maintain your best Medicare coverage over your lifetime. Now, this video has chapters, so you can skip ahead or go back as you wish. So check out the menu in the video description below, or you may also be able to find it just below on the bottom of this video. I will not be discussing Part D prescription drug plans in this video, and this is because there will be significant changes in 2025 to Part D prescription drug plans that will best be addressed in a separate video that I will produce as we get closer to the 2024 annual enrollment period. That way we have actual news about the changes rather than speculation. So let's start by looking at original Medicare, which impacts both Medicare Supplement plans and Medicare Advantage plans. If we haven't met yet, I'm Matthew Clausen, CEO of MedigapSeminars.org. We are one of the premier independent insurance brokerages in the country that specializes in Medicare. Our services are free to you, the consumer, and our goal is to help you make an informed decision regarding your Medicare. Feel free to contact us for personalized advice about your situation. Original Medicare is Medicare Part A, inpatient services, and Medicare Part B, outpatient and physician services. Let's start with Part B. The Medicare Part B features that change with inflation include the Part B premium, what you pay monthly, and the Part B annual deductible, so what you must pay on a calendar year basis before the Part B coverage begins. The fact that Medicare pays 80% and you or your supplement pay 20% will not change over time. That can only be changed by an act of Congress. The Part B premium is indexed to inflation, the Consumer Price Index, or often referred to as the CPI. The Part B deductible is indexed to increases in the average medical expenditures. Medical expenditures often increase at a rate greater than the Consumer Price Index. I recently did a video on Medicare's own estimates of the Part B premium, and the deductible go all the way out to 2032. And their estimates have been very accurate. And I suggest you check out that video after this one. I must note that Medicare has already shown us that they are willing to make exceptions with the premium, just like they did when they increased the premium in anticipation of higher costs due to an Alzheimer's drugs just a couple years ago. That was a political mess that had to be reversed the next year when the drug proved to have no reasonable efficacy. Keep in mind with Medicare and everything that we cover, there are always exceptions. For those with higher than average incomes, there is an income-related monthly adjustment amount, or IRMAA charge. The IRMAA charge increases your Medicare Part B and Part D premiums. And the entire IRMAA table is linked to the Consumer Price Index. For example, in 2024, in order for an individual to be subject to an IRMAA charge, they must have a modified adjusted gross income as of 2 years ago of at least $103,000. If this year's inflation rate, the CPI, showed inflation at 5%, then next year a person would need to have earnings of 5% more, or $108,150 to qualify. For more information on IRMAA, please see my article and the video on IRMAA linked above my left shoulder. So now let's talk about Medicare Part A inpatient services. Most people have already paid for their Medicare Part A through payroll taxes. That's the Medicare deduction from your paycheck. That payroll deduction pays for Part A. If you or your spouse paid that payroll tax for at least 10 years in your lifetime, then your Part A is fully paid for. Of course, if you must pay a Part A premium, that amount is not random. It's 45% of Medicare's actual cost, and it's reevaluated annually. What's important to know is that the gaps in your Medicare Part A coverage increase more due to actual increases in medical costs than due to inflation as measured by the Consumer Price Index. Now, this is the Medicare Part A for 2024. The Part A deductible is currently $1,632 and is governed by Section 1813 of the Social Security Act. With this section, which is 1886 and a bunch of letters, that discusses a weighted average of the increased medical costs that result in annual changes. I know some of you are just dying to read that, so you can go ahead and Google that. Also, in case you didn't know, the per-day copay, the copay that starts at day 61 and goes all the way to day 90, is also 1/4 of the deductible. Do you see that? And the per-day copay for days 91 through 150 is 1/2 of the deductible. That relationship is fixed. It won't change. The bottom line is that the Part A deductible is directly influenced by increases in medical and Medicare costs, which are influenced by both inflation and decreasing health in the average population. So next, let's talk about Medicare Advantage plans, how they are impacted by inflation, and what other important features of the Medicare system can impact your benefits and your costs. Most importantly, I'll show you how you can easily hedge against the increased costs over your lifetime or decreasing benefits for very little money. Now, most people have no idea they can actually hedge against the effects of rising costs with Medicare Advantage plans. If you have no interest in Medicare Advantage plans and want to skip to the Medicare Supplement plans portion, skip to this time on the video. Go ahead. Okay, now that they're gone, here's the secret sauce recipe. Any factors that increase the deductibles and copays of original Medicare negatively impacts your Medicare Advantage plan, but in a manner that may be different than you suspect. Medicare Advantage plans are non-guaranteed renewable annual plans. That means that the benefits and costs change every calendar year. Many of the most popular Medicare Advantage plans have no monthly premium other than the Medicare Part B premium that you must pay no matter what. So just to be clear, when you get a Medicare Advantage plan, you must still pay the Medicare Part B premium and any IRMAA charges. If a plan has no monthly premium, how does it adjust for inflation? It adjusts by reducing benefits. So think of it this way. The Advantage plan is supposed to provide an actuarial equivalent or average benefit equivalent to original Medicare Part A and Part B with no supplement, just original Medicare. If your deductible and coinsurance or copays for original Medicare increase, well, that's tantamount to a reduction in benefits because it's more money that you must pay out of pocket. Thus, the Advantage plans respond in kind by reducing their benefits and increasing the amount that you may be liable for out of pocket. And there are different ways to do this. One, they can increase the allowed annual maximum out-of-pocket risk you have. And I remember the annual maximum allowed out-of-pocket limit for Advantage plans was $5,041 back in 2015, 9 years ago. Today, in 2024, it's $8,850 for in-network services and over $13,000 for approved out-of-network services. That's a 75% increase in less than 10 years if you stay in network. The Advantage plan can also add a deductible, increase co-pays, increase the co-insurance for major services, or increase the maximum out-of-pocket limit, as I'd mentioned earlier. They can also reduce the extra benefits like the dental, vision, hearing, or gym memberships, and so on. Now, I've seen that a lot. A new plan starts out with awesome extra benefits in order to attract new enrollees. And then a few years later, those extra benefits have been whittled down substantially. Employer group advantage plans also do this, but they often have a contractual 2-year benefit lock, so no changes until year 3 or so. Many companies will also increase their incidence of denial of coverage. Of course, they will likely deny that. Denial of coverage and complex pre-authorizations are a common tactic Advantage plans use to increase their bottom line. We've got 2 studies linked on my website. I'll see if I can link the resources page up here, 4 years apart, by 2 separate inspector generals of the Health and Human Services that say just that. And of course, recent congressional hearings as well. So in case you didn't know, Medicare pays a monthly fee with our tax dollars to the Advantage plan insurance companies for every person that they have on an Advantage plan. Now, the Center for Medicare and Medicaid Services, CMS, adjusts these payments to Medicare Advantage plans each year based on the average cost per capita of original Medicare and adjusted for health risks. That's important. Adjusting for health risks simply means that people with an active health history cost more. So the government pays the insurance company more for them than they will for a healthy person. The only problem with that is the fact that insurance companies have a history of labeling everyone on an Advantage plan as unhealthy, so they get the maximum benefit per person that they can. This level of fraud, according to MedPAC, has cost the U.S. taxpayer $88 billion in overpayments to insurance companies. $88 billion of taxpayer money. Now, Medicare announced that for 2025, according to Becker's Health, an online publication, Medicare Advantage plans will see a reduction in benefits of an average of $396 for 2025, even though costs will increase. So there are some states that have a reduction in benefits that'll be $1,000 or more. As I film this video, there is still a lot of passionate debate about this CMS proposal. Although anything can happen, right now, CMS has proposed an increase in risk-adjusted payments to make up for it. In other words, the insurance company will get even more money for those with an active health history, which motivates the insurance company to submit even more false information. Go figure. MedPAC, by the way, that I just mentioned, is a government agency that advises Congress on Medicare. They also very recently advised Congress to completely revise the Medicare Advantage program. So why do I bring this up? Because if you're choosing to go the Medicare Advantage plan route, you must plan for the fact that Advantage plans reduce benefits to adjust for inflation, increasing your potential out-of-pocket costs for medical care. In addition, you have high political risk with Advantage plans. Medicare Advantage plan benefits can change each and any year based on changing policy recommendations. So what's the best way to hedge against a long-term loss in benefits with Advantage plans? It's by adding an indemnity plan. An indemnity plan is a low-cost plan that will pay you, not your doctor. It'll pay you a sum of money if you're hospitalized or if you get certain expensive critical or chronic illnesses and so on. It significantly cushions the costs of any major medical event today and protects you from the declining benefits and increased costs over your lifetime. Ask us for details if you're interested. Now, let's look at Medicare Supplement plans and how they're impacted by inflation and what factors drive price increases over time and how to manage the rising costs. The good thing about Medicare Supplement plans is that the benefits never change. You will not see a reduction in benefits over time as you would with an Advantage plan. However, Medicare Supplement plans have a monthly premium, and you can expect that monthly premium to increase over the years based on both overall inflation, the CPI, or Consumer Price Index, and increased average medical costs. Keep in mind, the medical inflation is often higher than the CPI. Historically, it has been. The Medicare Supplement plan premium is impacted by increased deductibles, coinsurance, and copays of original Medicare. Why? Because the supplement will pay most of those costs. So here's two examples just to help. In 2015, the Medicare Part A inpatient insurance deductible was $1,260. As of 2024, it's $1,632. Now that's a $372 difference that the supplement must pay if you go into the hospital. And this is a per event deductible, not just annual. The second example is regarding Part B outpatient services. While the fact that Medicare will pay 80% and the supplement will pay 20% for outpatient services never changes, if the cost of an average annual outpatient service increases from $1,000 to $2,000 over 10 years, well, 20% of $2,000 is twice as much as 20% of $1,000, and your supplement, most supplements, must pay that. All those price increases are borne by the supplement, which then requires a higher premium if the insurance company wants to stay in the Medicare business, which many of them do. Now, there's one Medicare supplement that is most especially susceptible to inflation, and that's the high deductible Medicare Supplement plan. Now, this includes both the high deductible plan G and the high deductible plan F. The reason this is more susceptible to inflation is that the deductible for those high deductible supplement plans is directly linked to the Consumer Price Index, the CPI. If the CPI goes up 5%, the supplement plan deductible increases by 5%. And that deductible is the amount of money that you must pay in Medicare bills before your supplement pays anything. In 2014, 10 years ago, that Medicare Supplement plan deductible was $2,140. Today, it's $2,800, over a 30% increase in 10 years. If you consider the Medicare Supplement monthly premium also increases, you understand why we're very careful about when we recommend this high deductible supplement plan. In the wrong states, you end up paying more every year for less coverage. How do you manage the increasing premium of a Medicare supplement? Well, with a high deductible plan, you can use the same indemnity plan that you would use for an Advantage plan. It's very inexpensive and will often pay for those benefits that you would normally be paying out of pocket because they're part of your deductible. And there are a few other things that you can do. First, please do not get a Medicare supplement plan that you can barely afford today. Make certain that you choose a plan that fits comfortably within your budget. Second, don't think of your supplement as a once-in-a-lifetime purchase. Think of it as making a best long-term decision that you can do when you first start Medicare. Then reshop your plan when you're between 72 and 75 years old if you can pass underwriting. Often, the insurance companies that offer you the lowest price when you're between 65 and 68 years old are not the best value plans when you're in your young or mid-70s. You will likely have an opportunity to reduce your costs significantly if you can qualify medically. But let's wrap this up with a quick review. General inflation, as defined by the CPI, along with increasing medical costs, push up the price of original Medicare, and increase the deductibles and Part A coinsurance. That directly impacts Medicare Advantage plans, which respond by reducing benefits and increasing the consumer's maximum out-of-pocket potential cost for medical bills. You can hedge against these increased costs and decreased benefits over your lifetime with an inexpensive hospital critical and chronic illness indemnity plan. Unlike a Medicare Advantage plan, Medicare Supplement plan benefits never change, but the same forces that impact original Medicare result in higher premiums for the supplement plans over the long run. In addition, an aging population in your Medicare Supplement pool of policy holders will place a burden on the supplement plan prices that may result in higher premiums. To hedge against this, reshop your Medicare Supplement plan if you can sometime in your young 70s. Bottom line, you cannot escape increasing medical costs and inflation, but you can manage those rising costs. We at Medigap Seminars are here to help you do just that. So reach out to us. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.